My name is Stephanie, and I had the duodenal switch about a year ago. I've lost 156 pounds. About 6 years ago, I was diagnosed with PCOS, polycystic ovarian syndrome, and part of that is insulin resistance, which mimics type 2 diabetes, and I had blood sugar issues like type 2 diabetes. I also experienced an increase in my blood pressure. My average blood pressure on medication was about 170 over 100. That was about as low as I could get it. And I was also having issues with sleeping, with sleep apnea. Being able to walk down the street a block was almost impossible for me. I would have to stop and rest and catch my breath. Walking upstairs was nearly impossible. I have 3 children, and so the idea that there was a very real possibility that I wouldn't get to see them grow up really hit home for me. And so I decided to look into weight loss surgery after years and years of dieting and losing weight, gaining it all back, and just adding insult to injury on my health issues. Well, before I left the hospital, my blood sugar issues had already resolved themselves. I went from a resting glucose level of about 120 to a resting glucose level of 79. My blood pressure had already resolved itself. Like I said previously, my blood pressure was about 170 over 100. Before I left the hospital, it was about 115 over 70, and today it's about 105 over 62 is what I normally run, without any medication at all. I now can easily walk 4.5, 5 miles. I engage in weight training about 3 times a week and cardio training another 2 to 3 times a week. I just have energy that I couldn't even possibly dream of before. I joke all the time that Dr. Stewart not only gave me my life back, but he gave me the life I always wanted that I never even thought I could ever experience.